A very good evening to all of you. Myself, Dr. Prateek. So today we will discuss about anatomy of nose. So this is a diagram showing the external nose, showing the dorsum. So what is important by examination point of view, the nose is consisting of two nasal bone plus rest of the part is made up of the cartilage. So there are, if we talk about the bony part, so the upper part of the nose is consists of two nasal bone plus frontal process of maxillary bone. So the bony part is above one is the frontal, then comes two nasal bone in the midline, and then comes the frontal process of maxillary bone. These are bony parts. Then comes the cartilaginous part, which forms the lower part of dorsum of the nose. So what is important is nose consists of three paired cartilage. So what are the paired cartilage? First one is the lateral cartilage, as you can see here. This is called upper lateral cartilage. Then comes the major alar cartilage, which is this. So also known as lower lateral cartilage or major alar cartilage. So it is present here. And third group is known as lesser alar cartilage, as you can see by this diagram. So nose basically having three paired cartilage, which are upper lateral cartilage, lower lateral cartilage, and lesser alar cartilage. And then comes one unpaired cartilage, which is known as septal cartilage. As you can see here, so if I mark this by the red color, so this in between structure which is sandwiched between the lateral cartilages, this is the septal cartilage. So one unpaired cartilage is septal cartilage, and rest there are three paired cartilage, which is upper lateral cartilage, lower lateral cartilage, also known as major alar cartilage, and minor or lesser alar cartilage. And external nose, we already discussed two paired bone, nasal and frontal process of maxillary bone, and one unpaired bone, that is frontal bone, which is coming from upside. Now one important point is nasal wall. It has been asked multiple times in the exam. What is nasal wall? So it is mainly formed by limen nasi, or we can say lower end of upper lateral cartilage. So this is my upper lateral cartilage. Suppose this is the lower end. So lower end of upper lateral cartilage, then comes anterior end of inferior turbinate. So we all know inferior turbinate start. So anterior end of inferior turbinate, it comes laterally. Medially it is septum, and above is the lower part of upper lateral cartilage. This is upper lateral cartilage. So try to remember how this nasal wall area is formed. Now, there are basically three mucosal types in the nose. The first one, we all know the respiratory tract is formed by pseudo-stratified ciliated columnar epithelium. This is ciliated columnar pseudo-stratified, which is mainly forming the respiratory mucosa. Only the anterior most part of the nasal, that is also known as the vestibule. So the vestibular part, it consists of stratified squamous epithelium, which is keratinized. So anteriormost part, or we can say vestibule, is formed by stratified squamous epithelium, whereas rest of the nose, excluding the olfactory epithelium, rest of the nose is formed by the ciliated columnar pseudo-stratified epithelium, which is also the respiratory tract epithelium mainly. Okay. And upper one third, which deals with the olfaction, is olfactory epithelium. Now there are two terms. One is a nasion, then comes a rhinion. So what is nasion? Nasion is intersection of two nasal bone with the frontal bone. So suppose this is my frontal bone, and then comes a two nasal bone. So the junction part is known as nasion. Okay. Then comes the rhinion. Rhinion is the junction of suture between two nasal bone with the cartilaginous part of the nose. The cartilaginous part is the upper lateral cartilage and the nasal bone. So this junction is known as rhinion. Now this is a diagram showing the lateral wall of the nose, which is very important for the examination point of view. As you can see, this is the lateral part. We can see the anterior boundary or the outline of the nose. So basically the lateral wall of the nose consists of three parts, that is known as three concha. The first one is the inferior concha. As you can see, this brownish grayish colored mark, it is a separate bone. So the inferior turbinate, we can say, so this inferior turbinate is a separate bone. Then comes the middle turbinate, and then comes the superior turbinate, and this is my inferior turbinate. So basically three concha. The first one is inferior concha, then comes the middle concha, and the superior one is the superior concha. And sometimes there is rarely fourth concha, which is also known as supreme. Sometimes there is fourth concha, which is supreme concha. So out of these, the inferior turbinate is a separate bone, and this middle and superior turbinate, they are not separate bone but the part of the ethmoidal bone. Now we can see the lateral view of the nose, where we can see the posteriorly there is a sphenoid sinus, superiorly there is frontal sinus, anteriorly there is, this is the nasal bone. If I mark it by the green, this is my nasal bone. Okay, and then there is lateral process of the septal cartilage and major alar cartilage, which we have already discussed in the previous diagram. So this is how lateral wall of the nose is made. Now what are the concha or the meatus present in the lateral wall? So now try to understand this. This is my inferior concha. As you can see here, this bluish lower one structure is my inferior concha. So the area lateral to this, or we can say the meatus part, this is known as the inferior meatus. And in inferior meatus, nasolacrimal duct opens up. Okay, so inferior meatus, that the meatal part lateral to the inferior turbinate is known as inferior meatus, where the opening of nasolacrimal duct is present. Then comes the middle meatus. So this is the blackest complete thing is the middle meatus, which is bounded by the middle turbinate. So this sky blue part is the middle turbinate. So this middle meatus is basically an opening for all the anterior group of sinuses. What are the anterior group of sinuses? Like the maxillary sinus. So this is the maxillary sinus. Then comes the anterior ethmoidal sinus and frontal sinus. Okay, so middle meatus is very important. It is an area or a meatal part which is having opening of anterior group of sinuses. And then comes the superior meatus, which is the above one. Okay, I hope this is clear. Now look at this diagram. This diagram just to simplify how this middle meatus anatomy is being made. So middle meatus, there is one structure known as the uncinate process. So this is a bony structure which is L-shaped like this. So this is an uncinate which is holding up or closing the middle meatus. And if we go inside, so there is the infundibulum part is there, in which the anterior ethmoidal cell, the largest cell, is known as the bulla ethmoidalis, which is present, and there is opening of the maxillary sinus and frontal recess. Now if we talk about inferior meatus, it is largest bone and it is a separate bone which is having the opening of nasolacrimal duct. And eustachian tube, that is ET, eustachian tube, just it is the opening of the eustachian tube is present in the nasopharynx, and it is around 1.25 centimeter posterior to the posterior most end of the inferior turbinate. So that means where the inferior turbinate ends in the nasal cavity. So if we go posterior to that, around 1.25 centimeter, there will be opening of eustachian tube. Then comes the middle meatus. It is the most congested meatus, and all the anterior group of sinuses open here, like the frontal, maxillary, and anterior ethmoidal. So together these sinus opening, they form the osteomeatal complex, which is also known as Picardal circle. Every point is important for the examination point of view, so try to focus. So look at this diagram. Suppose this is outline of my uncinate process which is guarding the middle meatus. So in the middle meatus, this is the arrow, this is the opening of the maxillary sinus. Then this is the bulla ethmoidalis, the largest cell, and this is the frontal recess opening. Okay, so these all forms the osteomeatal complex, which is also known as Picardal circle. Frontal nasal duct, it opens in the frontal recess. Okay, now one important point is sphenopalatine foramen. What is the sphenopalatine foramen? It is opening 1 centimeter posterior to the middle turbinate. So there is 3 parts of the middle turbinate. So the vertical part of the middle turbinate where it is attached to the lateral nasal wall. So sphenopalatine foramen is 1 centimeter posterior to that middle turbinate attachment. And from this foramen, the sphenopalatine artery comes or enters into the nasal cavity, which is a branch of the maxillary artery. Now let's talk about sphenopalatine fossa. See, firstly try to understand where this is sphenopalatine fossa is located. So if suppose this is my maxilla, below the cheek, beneath the cheek there is a maxillary bone. So if we goes behind the maxilla, that is behind the posterior wall of the maxilla, so then comes a sphenopalatine fossa, which is basically guarded by sphenoid bone and the palatine bone. So the sphenopalatine fossa, which is posterior to the maxillary sinus, it is having the foramen rotundum, and this foramen rotundum is having the exit or the passage of the maxillary nerve. So from the foramen rotundum, the maxillary nerve enters or enters into the cavity. Then there is a median canal through which the median nerve passes. And this median nerve is responsible for the parasympathetic activity in the nose. And sometimes some patients which are not getting benefit by use of the anti-allergic, antihistaminic, etc. So sometimes we have to do the median neurectomy so that the median neurectomy we can decrease the parasympathetic OA activity, and thus we can reduce the congestion in the nasal cavity. So sphenopalatine fossa, it is having some of the important structure. The first one is a maxillary nerve, then comes a median nerve, and then comes a maxillary artery. I have already discussed you the sphenopalatine artery is a branch of the maxillary artery which exits through the sphenopalatine foramen and enters into the nose, and this artery, the sphenopalatine artery, is a major contributor to the blood supply of the nasal cavity. And most of the patient, if the area of the bleeding in the nose is of either the Little's area or through the branches of the sphenopalatine artery. And other structure is the sphenopalatine ganglion. So I hope this is clear. Now there are some of the cells present in the nasal cavity. We will try to understand by means of the CT scan. So this is my coronal section. What do you mean by coronal section? If I cut the body like this, so I will open up the sinuses. So you can see the orbit, the bigger round structure. These are the orbit. And then there are certain cells. So first one is the anterior ethmoidal air cell, which you can see this. This is my ethmoidal bulla, which is the largest anterior ethmoidal cell, also known as bulla ethmoidalis. So this is the most prominent air cell which is present in the middle meatus. Here in this diagram, you can see in the CT scan, this is my middle meatus. This is my uncinate process. So I'll write it down by U. So this is my uncinate process which is guarding the opening of the maxillary sinus. This is my middle meatus, and this is my bulla ethmoidalis. In this diagram, which is the sagittal section, you can see this is my bulla ethmoidalis. What are the other cells? Then comes the Agar-Nasai cell. So by the name itself suggests the cells which are most anteriorly placed. So Agar-Nasai cells is the cells which are present most anteriorly. So here in this diagram you can see this is my Agar-Nasai cell, which are the anterior most cells which are also anterior to the bulla ethmoidalis. And generally, if while doing the FES or endoscopic sinus surgery, what we do, we just remove the anterior Agar-Nasai cells, and we can thus have access to the frontal recess. So its size determines the frontal sinus drainage. Then comes the Heller cell. So what is Heller cell? This cell is located in the inferior part of the orbit. So this is the inferior-medial to the orbit, or we can say superior to the maxillary sinus. So this is my maxillary sinus. Suppose this is my maxillary sinus. I am writing by the M. So superior and medial to the maxillary sinus, or we can say inferior and medial to the orbit. So this is the cell which is known as Heller cell. So it is present in the floor of the orbit. Again, very important, has been asked in previous examination point. And what is the importance? Sometimes, because if this cell is larger, so it can block the opening of the maxillary sinus. So suppose this is the maxillary sinus opening. So by this cell, the maxillary sinus opening, can be hindered or blocked. Now, other group of cell is known as Onodi cell. So, how to remember? Onodi cell is somewhere relation to the optic nerve, O for O. So, Onodi cell is the posterior most ethmoidal hair cell. So, posterior most cell is the Onodi cell, which is in close proximity to the optic nerve. Okay, so if we try to remove this Onodi cell, here you can see in this diagram, if I mark it by the red, or we can say the star color, this is my Onodi cell which are present in the roof of the sphenoid sinus as shown in this diagram. So this is the posterior most ethmoidal cell which is present in the roof of the ethmoidal sinus, and it is in close proximity to the optic nerve and the carotid artery. So we have to be very cautious while operating over this Onodi cell. Now let's talk about venous drainage of the face, or we can say nose. So this is a diagram which is showing the sagittal. If I cut down the face into the heart, so this is a sagittal view. As you can see, the nose, they are mainly draining by the facial vein, which is going like this, and the angular vein. This is my angular vein, and then comes a nasofrontal vein. So in the nose, we are having the drainage, venous drainage, by means of angular vein, which are connecting with the facial vein, and these all vein further connecting with the pterygoid plexus. And finally, they are entering into cavernous sinus. As you can see, this is my bluish line. You can see this is my inferior ophthalmic vein, and there is superior ophthalmic vein. This is my superior ophthalmic vein. So how does the venous drainage happens? By means of angular vein, the facial vein. They have connections with the pterygoid plexus. This pterygoid plexus is located posterior to the maxillary sinus, or we can say at the level of the sphenopalatine fossa. So these pterygoid plexus, facial vein, angular vein, by means of superior and inferior ophthalmic vein, finally draining into the cavernous sinus. So look at this diagram. If any infection in the paranasal sinuses, any infection in the facial, like the eyeball or the maxillary sinus, this can directly enter into the cavernous sinus. So that's why this area or this venous drainage is very important, because any infection, if that is not being treated on the time, may lead to cavernous sinus infection or cavernous sinus thrombosis. Now let's talk about dangerous triangle of the face, or the dangerous area of the face. So look at this greenish diagram showing the upper lip, the nose, L of the nose, and the bridge of the nose. So this is the area if any infection happens there. So by means of this venous drainage, the infection can directly goes inside the cavernous system. Now let's talk about the blood supply of the nasal cavity. So we all know the Little's area. This is a diagram showing the nasal septum. So anterior most part is the Kieselbach's plexus, or also known as Little's area. Little's area. Okay, so this Little's area, as you can see in the diagram, is basically formed by the anterior ethmoidal artery. Then comes the sphenopalatine artery. Sphenopalatine artery, you can see this is my sphenopalatine foramen. From there the sphenopalatine artery is coming out, and it is giving supply to the nose and going anteriorly at the level of the Little's area. Then there is a branch is there, greater palatine artery. So this greater palatine artery again running in the palate and supplying to the Little's area, and the lastly it is the superior labial artery, which is a branch of the facial artery. So these four particular branches, they are forming the Little's area. So if examiner want to ask, so what is the arterial supply which is not supplying to the Little's area, is the posterior ethmoidal artery. So the posterior ethmoidal artery is the only artery which is a direct branch of the internal carotid artery. See, anterior and posterior ethmoidal artery, these both are branches of internal carotid artery. Okay, so this internal carotid artery is giving two branches, anterior and posterior, out of which the anterior ethmoidal artery is contributing to the Little's area, whereas the posterior ethmoidal artery is not contributing to the Little's area. So this has been asked in the exam. So Little's area is basically supplying from mainly the four branches: anterior ethmoidal artery, then comes a sphenopalatine artery, then comes a greater palatine artery, and lastly the superior labial artery, which is a branch of the facial artery. So mainly it is having blood supply from the maxillary artery branches, and one part is from the anterior ethmoidal artery, which is a branch of the internal carotid artery. Now there is another area which is known as Woodruff's plexus. So here you can see by this blue diagram. So this Woodruff's plexus, this is having an anastomosis between the sphenopalatine artery and the posterior ethmoidal artery, and this Woodruff's area is present in the posterior part of the lateral nasal wall, or we can say at the level of the posterior end of the inferior turbinate or the middle turbinate. So sometimes in elderly patient or in adulthood, sometimes the bleeding is from the Woodruff's plexus, and this may again need the nasal packing, that is anterior nasal packing, as well as the posterior nasal packing. I hope that is clear. Now let's discuss some of the points about the physiology of the nose. So the main current of the airflow, it is in from the parabolic curve, and it is in the middle part of the nose. So suppose this is my nose and this is my palatine bone. Okay, and suppose if I draw out three of the turbinates, so this is my inferior turbinate, then comes my middle turbinate, and then comes my superior turbinate. So the main airflow current, that is the main airflow, is in from the parabolic curve like this. So look at this diagram. The air mainly is flowing at the level of the middle turbinate. At the level of the middle turbinate, not at the level of the inferior turbinate. So it is in parabolic curve and mainly at the level of the middle turbinate. Then ventilation of the sinuses, it occurs in expiration, not in inspiration, has been asked previously. So sinuses get ventilated when we expire the air. Then third point, nasal cycle, it completes generally or varies between 2 to 4 hours. Okay, so one of the nasal cycle duration is around 2 to 4 hours, and the nasal mucosa, it is having the mucus blanket. There is a mucus secretion obviously. So this mucosa, it generally moves slowly. So what is the speed of the nasal mucus blanket? The speed is 5 to 10 mm per minute. So nasal mucosal blanket, it moves at the speed of 5 to 10 mm per minute. And see, inspired air, whatever we inspire, it is generally humidified to the 75%. Try to remember each and every point. This has been asked in the previous papers. So inspired air is humidified by the nose till 75%. Then anterior 1/3 of the nose is the area which is maximally affected by the hot or cold air, because the first exposure is in the anterior 1/3 part of the nose. So it is mostly affected by the hot and cold air. Then comes a rhinomanometry. What is this? So rhinomanometry is a test which generally measures the flow and the resistance to the air produced by the nose. So what are the resistance being offered by the nose, by the Lyman nasal, we can say, or by the turbinates, hypertrophy, or anything which is providing a resistance to the nose. So by means of rhinomanometry, we can detect the flow, airflow, and the resistance being offered to the air entry. So I hope